Let's bring him in, Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center. And Joe, long, grueling seasons, no matter what time of year it is, whether it's baseball, football, or now we're into the NBA playoffs, and we're seeing the effects of that in the NBA playoffs of players dropping left and right.
Yeah, Ray, it really occurs at every level of all sports. And so, I have a friend who kind of likes to tweak me kind of frequently, and he always says, he has this saying, sports very often come down to the medical team, to the injury list, to, what's going on injury-wise. And that certainly happens in high school. We certainly see it in college. And so teams can be on a great run and have a good team. It happens in the professional ranks as well. That's what I based a book on that I wrote 5 years ago about how in Cleveland sports we seem to be snake bit with injuries at bad times. The timing also plays a big role. But the timing this week is really uniquely interesting to me. I don't remember a time where three bigger, more important players to their team are out and injured, and it has such a huge effect on what's going on with the NBA playoffs. This is the time of year where people are focusing in on that a little bit more. Of course, the 76ers, Philadelphia, this is their chance to make a run, and their absolute star player, is out with a banged-up knee a little bit. And in the going over to the Mavericks, a wonderful player on the Sixers, Joel Embiid. On the Lakers, the sidekick for LeBron, Anthony Davis, is at the peak of his game, but a groin injury, and if he doesn't make it back, there's very little chance they make it back to the playoffs, championships, and probably win it. And then just a wonderful player that's brought a lot of excitement and kind of new joy to the NBA to watch is Luka Doncic. And watching him play in the first few games, he was just absolutely scintillating. What a great player. And then all of a sudden, he's running around with an injury to his neck, and we're told that he has numbness and weakness down his arm, and he has a game where, oh my gosh, he's 1 for 7 from three-point range and 0 for 5 from the foul line. He's running around hurt, and they look terrible, and they lose the game, and it looks like they've lost the momentum and could very well get bumped out. We'll see if Doncic is able to recover it all tonight. His injury is probably the most interesting one. It is one that we see in a lot of different sports. You can see that he has an injury to his shoulder. He has weakness. He has neck pain. One of his coaches said he makes a living of playing basketball on a swivel. And for people that love basketball and point guards, the key of what they're saying there is he sees the whole court. He's so good at being able to see the whole court. And right now he's so limited. He can't move his neck very well. He's not making the beautiful passes. He's looking terrible from actually being able to shoot. He's trying hard to play through it, but you can see the left arm, the left shoulder is weak and in pain and troubled. And so whether he'll be back, one of two things is going on with him with the pinched nerve in the neck, Ray. We talk a lot about stingers, and what happens in a stinger is you stretch or bruise the bundle of nerves that come out of the neck and go down the arm, and you end up with weakness and pain in that arm, and it's very hard to play sport basically with one arm. The other is he could well have a neck injury like a disc. He's not moving the neck very well at all right now, and so they're doing absolutely everything I know on the sports medicine side in the 24 to 48 hours they have between games to try to get him ready. But a lot of times, my friend is right, the medical team and injuries and timing of when these injuries occur have a very large effect on almost all sports, going all the way down to our high school heroes here and our college athletes and our professional athletes, Ray.
Yeah, exactly. And Joe, from a medical standpoint, it brings about the question of training. Is there too much training all the way down to the high school athletes? And are these seasons too long?
There's no doubt the change in training through the 30 years of my career is huge. And I think definitely at the professional and college level, but I'll take it all the way down to the high school and youth level. Yesterday, I went down to see, because we're looking at working with some programs at Pinnacle Sports. Do you know where that is on 18?
I do. Yeah, I've been there many times.
Many sports complexes like that in our area where kids work out and train and run and play in a year-round fashion, and they enjoy playing, and kids who enjoy playing and to be the best they can be. And so there's absolutely no question in my mind that we have athletes that are bigger, stronger, faster. But as you push athletes to be the very best they can be in the training and in the weight room, there certainly are kids who fall off on the other edge of injury. I mean, that's what our office is full of. And so fully a third to a half of our athletes that we'll see today will be people that are related to overtraining, overuse, overstress injuries, stress fractures, and so forth. And so there's no question about that. And again, sports teaches a lot of great life lessons. So we want very much to support these kids and get them through to do the things they love to do and play at their highest potential. But there's no question that as the training has gone up each of the last several decades, there's no question that a lot of the injuries that we see are directly related to when you cross that line and get into that area, that gray zone of overtraining, overstress, overuse. And so we have to be very careful. We have to do a lot. Coaches do a lot of this, as you know very well. Athletic trainers do this very, very well. A lot of counseling athletes about making sure that they're not overtraining and overusing and getting enough rest and doing it in a reasonable way and working on different parts of their body and doing exercises that are safe, and especially for the size and the weight class they're at. So a lot of people want to jump in the room and do things they see the high school kids doing or the college kids, and it's beyond where they're at that time. So there's a lot of good people out there to give advice, and sports physical therapists, sports trainers, coaches know they're training a lot, and of course sports medicine people. But you're absolutely right. The training levels are much higher, and in that happening, there are a lot of kids that are injured, and so we have to keep an eye on that at all levels. But it really is a unique time, and it just caught my attention of how important the timing is on these three NBA injuries that are going on at the same time.
All right, Joe. Thank you again, my friend, for the visit. I know each and every day is busy for you. We always appreciate the few minutes with us here on WAKR. Thanks, Joe.
Oh, I love it. I love it, Ray. Have a great week, okay?
You too, my friend. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center.